Hi everyone, welcome back to the Rising Nurses Next Generation Nurses. Today we are diving into crucial electrolyte imbalance hyponatremia. If you work in healthcare, you will see this often and knowing how to recognize and treat it can save lives. Hyponatremia means the sodium level in the blood is less than 135 milliequivalent per liter. The most common reason is too much ADH. That's the hormone that tells the kidneys to hold on to water. This can happen for physiological reasons like low blood volume or pathological reasons such as SIADH, syndrome of inappropriate ADH secretion. But sodium can also drop without ADH being involved. For example, primary polydipsia, severe starvation, or when there is another particle in the blood like glucose pulling water in. Symptoms can range from mild like confusion, muscle cramps, lethargy, nausea to severe including seizure, coma, and even brainstem herniation if untreated. Always correlate symptoms with sodium levels and how quickly they drop. Diagnosis: the first lab to check is serum osmolality if it is low under 280. We call it hyponatremia, which is most common type between 280 to 295 is usually a lab artifact from high lipids or proteins. Above 295 usually means hypertonic hyponatremia, often due to high glucose which need correction. For hyperglycemia, remember the correction formula. Add 1.6 milliequivalent per liter sodium for every 100 mg deciliter glucose over 200. For example, if sodium is 133 and glucose is 400, your corrected sodium is around 136. Treatment depends on the cause and volume status. Hypervolemic or euvolemic cases often need water restriction and sometimes diuretics. Hypovolemic patients need sodium replacement if sodium is dangerously low below 120 and the patient is symptomatic. Consider 3% hypertonic saline. But remember, correct slowly, no more than 10 milliequivalent per liter in 24 hours to avoid osmotic demyelination syndrome. Hyponatremia might look just a like lab value, but in reality, it is medical emergency when severe. Recognizing the cause, checking osmolality, and treating carefully is key. If you found this helpful, hit like and subscribe for more nursing education videos.